Welcome back to another episode. We're so excited to have Dr. Noah here. In this bite-sized nugget, we're going to talk about preconception, what you should be doing to get yourself ready to give birth, because a lot of people don't talk about that. We're going to dive deep into that, what you should be doing during pregnancy, and what you should be doing and taking afterwards to recover. Welcome, everyone, to another episode. Today, we're featuring Dr. Noah. We're so excited to have him here. He's going to be giving us the 411 on what you should be doing preconception, postpartum. We're also going to get into some common ailments that our kiddos will be seeing this school season and how we as moms can be prepared for battle, and maybe some travel tips and things we should take with us. So welcome, Dr. Noah. And I think we should start out with a little bit about yourself. I know all about you, but a lot of our listeners probably don't. Like, what are your credentials and how did you get here?
Great. Well, thank you very much for having me. It's always fun to talk to new people and talk about different topics. I'm a chiropractor by license, but most of my practice is more nutritional. That's the majority of the people that come to see me. Work with anything from newborn babies up to elderly. I think the oldest I've worked on is 95 years old, maybe.
Wow.
So really whole broad spectrum of people. I try to make things simple from a natural approach. I focus a lot on diet. I warn my patients before they come and see me. I'm like, if you want to come and work with me and actually get results, like give me 4 at least good weeks of a strict diet, and everyone is different and unique. And let's do that. Let's try to optimize your health, optimize absorption, gut health, if people need to detox heavy metals, different things like that. And that's what I work on to really get people thriving. A lot of the people that come and see me, they have normal blood work, or they've been told they're fine, or they've been diagnosed with a lot of things and seen 30 doctors and haven't gotten better. I'm blessed. I grew up with, my dad does the same work. I've learned most of what I do from him. We work together, and we teach a lot of doctors all over the country also. This year alone, we've taught in Dallas, France, Italy, Los Angeles, and then we're going to be teaching in Atlanta and Nashville. So we teach a lot of doctors the nutritional work that we do, which is kind of a fun thing also.
Okay. I think he's qualified, everyone.
I mean, I'm like, wait, can I meet you in Nashville? And then you give me like an appointment. I want to see you.
Okay. So we brought you on because we had some feedback from our listeners, and they want to know, what should they be doing preconceptually? Like, how do we get ourselves and our bodies best prepared for, taking on a pregnancy?
That's a great question. There's a lot you can do. I mean, the first thing is, do you feel healthy going into it? Because the healthier you feel going into it, the healthier you will be during it. The more nutritious you are. It's not just taking your prenatal once you find out you are pregnant. The months leading up to it will affect your ovaries. They will affect your eggs. They will affect your fertility, all of those. And it goes on the male and on the female, on both of them, because male sperm quality is a huge issue. I mean, testosterone's decreased a lot in this country. And, I encourage a lot of men to get healthy also before trying to, conceive with their wife, just because that will really help the pregnancy also. And that can vary in a lot of different ways. If people have a lot of digestive issues, if they have a lot of headaches, if they have thyroid issues, it's ideal to fix those before getting pregnant. Can't always be done. But when people are thinking of starting to get pregnant, obviously eating better is one of the best things, cutting out sugar, cutting out alcohol, getting plenty of sleep. Personally, I lean towards a meat-heavy diet. I think eating a lot of grass-fed red meat is also very good, because that's where you're going to get a lot of the good, high-quality fat for hormone production. And you need hormones to help with everything. When people are trying to conceive, in a lot of cases, I'll recommend starting to take a prenatal before trying to conceive a few months. And also for men, sometimes taking a B vitamin, especially if their diet is lacking, because if they have enough folic acid, if they have enough B12, different things like that, then that's going to increase the egg and sperm quality. And I mean, with that being said, most prenatals and multis on the market are just junk and belong in the trash, unfortunately. They're doing probably more harm than good, in my opinion. A couple things I like to look for, like if you look on the label of a
Okay.
prenatal or a multi, if it says folic acid and nothing
Yes.
else, it's the cheap form. Probably half the people in the population of the US can't convert it into the active form in the body. So
Wow.
most people would want 5-MTHF, 5-methyl tetrahydrofolate, which would be the active form of folic acid.
Okay.
Same type of thing if you look on a multi or on a prenatal and it says cyanocobalamin. That's the cheap form of B12 that honestly doesn't work well. Most people should be using methylcobalamin. There are a few exceptions, adenosine hydroxycobalamin, but as a general rule, if it says cyano, it's the cheap stuff. It's not going to get absorbed or work well in the body. So, there's a couple simple ways. Those are like 2 ingredients I automatically look at just to see, is it even decent quality or not? There's a lot more to it, but those are like 2 of the easiest things you can look at just to almost pre-vet some things.
Is there like a certain company that you find these higher quality supplements in?
There are some brands that are definitely much better than others. The one that I've used most often as a prenatal in my office is Thorne Research. They make a pretty good one. There's a lot of other people that really like Seeking Health or Needed. I think those are also pretty high quality ones. They're not perfect, but I think those 3 are 3 of the best on the market currently that at least uses the active forms, don't use as many of the junky fillers and things like that. So those are probably 3 of the better that you could get.
So you're saying start that like at least 3 months?
I would personally.
Okay.
I think maybe for women, they might not need a full-on prenatal, but maybe like a B complex, which like Thorne Research makes sense. Really, preconception, B12, folic acid, or folinic acid, and B6. Those are some of the more important things for men and women. If you're eating a pound of red meat a day and you're not eating a lot of junk inflammatory foods, you probably don't need that, in all honesty.
Okay.
But especially people on more the typical diet, even the slightly healthier, taking like a B complex from Thorne Research or something like that will really optimize egg health and sperm health.
That's amazing information, but it makes me so sad as like someone that's not in medicine and not privy to this type of information. And I always thank my chiropractor because I swear all of the supplements I've ever taken, I know that it's been from a trusted source. But for just the general public to know that millions, if not billions of people are basically scammed by marketing and they think they're doing the right thing. And then here we are to find out that like our body doesn't even absorb what they're marketing that it's going to for whatever reason. This is like so helpful.
Absolutely. Okay. So let's say, so we do our prenatals, we get pregnant. What should we be doing while we're pregnant?
You have, let's say, lifestyle factors, and then you have more, I'll talk diet and supplemental factors, let's say. I mean, lifestyle is, I always say don't slow down, and like being active is so important, especially during pregnancy. If you were completely inactive, you never ran, you never lifted weights, when you're pregnant is probably not the time to start. Walk.
Right.
Yeah. Don't never go for a run, get pregnant,
Move
and start
your
running
body
a day.
Yeah.
But if you're already active, you can exercise, you can lift weights, you can light jog while pregnant. So don't say, oh, I'm pregnant, I can't do that.
Do it.
I think that's one thing of just staying active. You do need to eat extra good quality food while you're pregnant. Don't use that as I need to eat all this junk food and double my calories and put on 50 pounds also. That's not healthy. Getting a lot of good, nutritious food. I mean, especially red meat is one of the best things. Lots of fruits. If you do well in veggies, those types of things. Cutting down on sugar is going to be very important. One thing too is trying, again, you have the big things and you have the smaller things. Preconception and also once you're pregnant, cutting back on a lot of general household cleaners, makeups, cosmetics, things like that are very important. They've found hundreds of chemicals in the average umbilical cord now just because of our environment and what you're exposed to. Any lotion you put on your skin, is going to get absorbed into the body. If you paint your nails with the normal nail polish, it actually has endocrine, so hormone disrupting chemicals that are detected in your blood within 15 hours from painting your nails.
Wow.
There's much better nail polishes out there. I did a video on that with my daughter a while ago. I have a 4-year-old. I never thought about nail polish, but then she wanted some. So I'm like, ooh, let's find out the better ones out there.
Yeah.
So minimizing your chemicals as much as you can be very important. Optimizing your diet. I mean, again, cutting out the processed junk food is huge. Eating more high quality meats, eating good high quality foods. I mean, I understand not everyone could afford organic. Totally get that. If you can, great. But if you can't, you can at least cut out all the processed junk that wasn't even food 50 years ago. That alone goes a whole way. Cutting out the MSG, trying to minimize the seed oils, again, cutting down sugar, those types of things. Cutting out caffeine. That is a huge one. They've actually found caffeine can cause increased heart issues in babies and things like that from the mom taking it. Whatever mom takes, baby's going to get also. That's a big thing. Like ideally, you don't want to take things like acetaminophen while you're pregnant, and that's why like if you're a chronic headache user, best case, you figure that out before you get pregnant so you don't have to take things because that can actually be damaging for the baby. Getting lots of sleep, that's very important. Listening to your body is very important. If you're tired, don't push yourself running that day. So again, you're growing a human. It's amazing. But it takes a lot of time. It takes a lot of energy. So make sure that you're resting. A couple things I will say going along with that. So I definitely do recommend a prenatal while pregnant. I think it can be very beneficial. Sometimes though, depending on each person and their needs, a prenatal isn't enough. So if people are, let's say, have really bad morning sickness, sometimes taking extra B12, especially in the form of methylcobalamin, or taking extra B6, especially in the form of pyridoxal 5-phosphate, that's the better type of B6, that will actually really help with morning sickness in a lot of cases. And some people, again, need more than you'll get in a prenatal by taking a separate supplement. And that can be really beneficial. I know I'm talking a lot. Sorry. One other thing I'll just throw in
this is great.
A lot of pregnant women, if they have bad morning sickness, morning sickness in some ways is telling you to slow down. Don't push yourself too much.
Interesting. I didn't know that.
It can definitely get way out of control and it's horrible. So taking, again, B6 or B12 can really help with the nausea and the morning sickness. But one thing I found that works really well is, and I usually don't recommend this, but almost eating nonstop. So like for my wife, when she was pregnant, she'd keep a box of Simple Mills, which are basically like a nut and seed crackers on her nightstand. And when she woke up, she'd eat a handful of crackers within like 2 minutes of waking up. And if she didn't, she'd start to feel morning sickness. And then she would have a little snack every like 30 minutes throughout the day, the first trimester. And it pretty much eliminated the morning sickness by doing that.
Oh, wow.
I've had a lot of patients where it does also. You don't want to have high carby foods that are just going to swing your blood sugar, high sugar, that type of thing. But eating some nuts, some crackers, some things like that can be really good to keep you from having those blood sugar dips, especially during pregnancy. And that can really help with morning sickness, especially in the first trimester.
Awesome tips. Thank you for that.
So what's interesting, and I want your opinion on this, is so I was pre-IVF and I miraculously am one of those, lucky lottery winners where we ended up getting pregnant naturally, right? Like literally the day I picked up my IVF medication is the day I found out I was pregnant.
Wow.
But because of that, I was basically treated gestational diabetes from previous testing that I had done through the IVF process. And so from day one, I was on a gestational diabetes diet, which genuinely, in my opinion, should just be everybody's diet because I ate so beautifully. I made sure that nothing was processed. I made sure that I, was cutting out the sugar. If I was having sugar, maybe it's blueberries or natural low sugar fruits. And I was able to ensure that me and Lakin was not a big child. And then he also didn't have blood sugar issues, which, it's one of the big reasons why is because your child will come out and have sugar issues right away. But that diet, kind of thinking back, is what you're talking about right now. Like, do you think following like a gestational diet, diabetic diet is really what we should be doing in general when we're pregnant?
Like lower carb.
Like lower carb, lower sugar.
Like higher protein.
It really wasn't like the list was nothing. It was basically just cutting out the crap. I didn't really have too much of a, like, I could have sweet potato, I could have potatoes, I could have rice, but I just had limited intake of it, or I would supplement it, in other ways.
I mean, I definitely do think a lower carb, less refined diet is going to be beneficial for everyone.
Yeah.
There's not one diet that's perfect for everyone. I mean, if you steer more towards a paleo diet, which is basically cutting out grains, cutting out refined sugar, I think that's it. Achievable and very realistic and overall healthy diet for most people.
Okay.
Some I'll go more strict on. But I think doing that is very beneficial. It's going to help with your blood sugar swings. It's going to optimize your energy, all of those types of things. I mean, one thing that you mentioned also with gestational diabetes. So I definitely do think the diet is huge. Without diet, you can't supplement your way out of a bad diet. You cannot. But I do know some people that have like amazing diets, and due to some reason, they do end up with gestational diabetes. There's actually really good research taking excess calcium will actually help with gestational diabetes. So if people either have family history or if they're tending that way, I'll have them take some calcium citrate, like 300 to 500 milligrams a day. And that can actually work wonders in lowering their blood sugar during pregnancy. Also, vitamin D supplementation can.
Interesting.
So sometimes, like I had a friend who had, she was leaning towards gestational diabetes and she already had a very low carb diet. And I had her supplement with calcium. And in a lot of cases, that can be really beneficial when the diet isn't doing it enough.
Yeah, that's good to know. I wish I would have known things like that. They had put me on metformin and it was like borderline, right? Like I wasn't like I failed the 3-hour test or whatever, but I was just borderline on the sugar. So we, took the conservative approach. But like I wish I would have known of some of these natural supplements that we can take. And I think that's a big takeaway if you're listening is seek counseling before you get pregnant or even during pregnancy to see what else you could be supplementing in your body so that you don't have to take some of this medication that big pharma wants you to take once you get to the point where, there's nothing else.
Return. Yeah, exactly.
One thing though on gestational diabetes, because I feel like it's getting more prevalent in pregnancies and even, type 2 diabetes in general, is the one thing that I was so upset about is they gave me metformin and it killed my stomach. And then I found out that like later on, I switched to insulin because I found out metformin goes through the umbilical cord to the baby.
Really?
And insulin doesn't. And I was like, what? Like, why is this not told? Do you have any good like resources on your website or things that pregnant people can see to get some of this information?
I didn't actually know that with regarding metformin, but I mean, I always think of whatever goes in a mom's mouth is going to make it to the baby.
Yeah.
So, it's like you just got to consider whenever you're taking something, a small amount is going to go to the baby. On my Instagram, I do have a whole pregnancy series.
Love that.
It's in like my highlights. I think I have like 7 videos. And in each one, I wrote out in the description, like I think I have one on gestational diabetes and I have another one on basically morning sickness and things like that. And I give a lot of recommendations that people can check out.
Awesome.
Yeah. So that's one way you can get a lot of info. And it's interesting, like one thing I forgot to mention was vitamin D. I mean, they've actually done a lot of studies that moms that are pregnant, like let's say if they don't get enough vitamin D, and especially from the sunshine is going to be best. Yeah. That'll actually increase cavities in kids because their teeth didn't form quite as strong. I felt that was a really interesting study. Ideally you can lift up your shirt, get the belly, get some sun on the belly, and that's perfect. But if you live in certain parts of the country, different times of the year, taking a vitamin D can also be really beneficial. Yes. And so even if like you went outside and braved the cold in the winter, your body actually doesn't make vitamin D because the sun doesn't get high enough on the horizon. So in certain parts in the winter, I mean, you could try to time your pregnancy. So like summer is optimal, getting all kinds of sun, but that's not realistic for most people.
Right.
Wow, I didn't know that. This is why I got to move down to Florida.
I mean, Florida, Hawaii. I mean, good Lord. That's crazy. So wait, should I be taking vitamin D, or anyone, pregnancy or not? Should we be taking extra supplements during the winter? Because we're going into the fall.
There's a lot of debate on vitamin D. There's a lot of mixed research on vitamin D. My general patient, I probably have 5 to 10% on vitamin D. So not a huge percent of my patients. But especially like as just a general recommendation, especially during pregnancy, I do actually recommend vitamin D. I think it can be beneficial, and any positives outweigh the negatives. But again, quality makes a huge difference. If you go to CVS, Walgreens, GNC, whatever, and you get a vitamin D, look at the other ingredients. A lot of them have things like soybean oil. So basically you're getting vitamin D with genetically modified, highly inflammatory soybean oil that's going to create inflammation every time you take it. So you're not actually even going to absorb the vitamin.
Wow. Insane.
That's crazy.
So again, quality matters.
Yeah. Is your mind blown yet?
I mean, like, it has been since the moment you introduced me to Dr. Noah. I've been obsessed. So what about coming out of pregnancy? And even, right now, especially like a lot of the moms that listen are working moms. So we're, hopefully 13 weeks, right? Paid leave. And then we're back to work. And I remember like coming out of, pregnancy myself, it was like, nope, you're good. After 8 weeks, if you pass all of these tests, you go back to your primary doctor, and the primary doctor is like, wait, they're not taking care of you. And it's like, you guys don't even know in this whole healthcare system who's supposed to be responsible for me.
Right.
So it sounds like I'm responsible for myself. And I truly, truly feel that women do not get back to normal until 1 to 2 years after having a baby. So can you give us advice on the post 2 years after pregnancy?
Definitely. I mean, it's one of those, it's honestly like how the mom takes care of herself shouldn't change after you give birth. I mean, if anything, your sleep's worse. You still need extra energy production or energy intake for milk production. I mean, you can increase your activity level, but a lot of the same things apply. Postpartum depression is unfortunately very common nowadays. There's certain things that, if the better you take care of yourself during pregnancy, the better mental support you have with family, with spouse makes a big difference. But sometimes even with that, it doesn't work. A couple things go along with that. I mean, again, diet's going to be huge. Making sure, again, you're getting enough good fat, good protein, especially for milk production. That makes a huge difference. Even if you do have to go back to work at 8, 12, 13 weeks, ideally, you can still breastfeed your child as long as possible, even if that's pumping and whatnot. It has so many benefits. I mean, if you think of breastfeeding, if your baby's sick, the mom's milk ducts actually detect what the baby has and will make antibodies that will then get pumped into the baby to help them fight off infections. If you get pink eye, breast milk works amazing. It's the perfect food for babies. Unfortunately, if you look at most formulas out there, I mean, they have genetically modified corn and soybean oil. Corn syrup is like 40% of what they are. They're just pure crap. There are much better ones out there, but even like the organic formulas, they're much better, but they're still crap in all honesty. I understand some people have to, and there are the better options then. But if you don't have to, it's definitely so much better for the baby to go as long as you can. Definitely getting more high quality fat, getting more protein will help with breast milk production. For women that are either worried about not producing enough milk or are having trouble, my favorite herb that I use is called Shatavari, Shatavari. I use one from Supreme Nutrition. And Shatavari, it's a lot of women actually use it during pregnancy. It can help with morning sickness. It also is good to help support your adrenal glands to give you energy throughout the day, and is completely pregnancy safe.
Amazing.
In Ayurvedic medicine, men and women actually use it to increase fertility, increase sperm count, different things like that. But it's my absolute favorite supplement for breast milk production. I know my wife could tell such a big difference within 2 days of taking it, like 3 a day. She'd be producing way more milk than if she didn't. And I know hundreds of other women that had similar results. Doesn't work for everyone. That's one of my favorites, in addition to eating more protein, eating more good fat. That can also, because of it balancing your adrenal glands, that can help with postpartum depression. But one of my favorite supplements to help with energy, because I mean, your sleep's wrecked for a long time.
It is, yeah.
In most cases, at least, and you have a lot of stress. There's a amino acid. It's found naturally in meat, L-tyrosine, and L-tyrosine in the body converts into dopamine, and then dopamine gets converted by your adrenal glands into epinephrine and norepinephrine. So those will help with energy, and they will help with mood. And they're not like caffeine that's like poke, 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 go, go, go. It's more just giving your body the raw building blocks to make them as needed. And I've used it with a ton of breastfeeding moms, and it can really help with their energy. Also, it's one of my favorite things to help with depression. It's one of my go-tos for both of those. The couple things I always tell people is take it in the morning. If you take it later in the day, it can keep you up at night. Also, it's best absorbed without food. So I usually tell people take it like at least 30 minutes before breakfast or at least 90 minutes after. And it just works better that way. But those are a couple things that I definitely see help with those.
Amazing. Thank you. I wish I knew this stuff.
I was one of those people, Dr. Noah, where I was by the bottle. No matter what I did, I pumped, and I think that might have been one of my errors, is I wasn't exclusively breastfeeding. And then obviously work was, I just wanted to get in the hang of pumping. And then it became to the point where I think like just the whole storm hit and it just wasn't working. And I asked so many times to my primary and to my OBGYN, like, is there any supplements? Is there anything? And they're like, no, just keep going, just keep going, just keep going. And it's like, had I known this, maybe I could have had a different story. I was able to breastfeed for a little bit, which was like amazing, but I wish I could have done it for longer.
Yeah, absolutely.
Oh, this is incredible.
The stress, and
stress, sleep, all of that added just to know that there's like information out there.
Yeah.
It's so important, the work that you're doing.